All right, let's spend a little bit of time talking about pregnancy nutrition. Hopefully, we've gotten mom involved in the preconceptual health care so that we can get everything in good condition before she gets pregnant, and that includes her diet. We want her to start taking folic acid. We want her to start eating well. We know that the healthier that mom is, the better the pregnancy outcomes. And all this includes her nutritional status prior to the pregnancy and then throughout the pregnancy. Being overweight or underweight at the time of conception can have implications on the pregnancy as well as the lifetime health status of our infant. Not everybody knows what good nutrition looks like, even nursing students. We may think we know what it is, or we may actually know what it is, but we know that we don't always eat healthy. One, because it's not convenient. Eating healthy is expensive and it's very time consuming. And sometimes with our day-to-day hectic lives that we lead, including pregnant moms, it's just so much easier to go through the drive-through real quick or eat on the go. Like when you're on campus, it's so much easier to grab something that's not healthy as opposed to walking someplace on campus that you might get a healthier diet. Why is nutrition so important? We know that pregnancy nutrition has impacts on the birth outcomes, same as cigarette smoking, drug and alcohol abuse, stress, insufficient prenatal care, chronic illnesses or chronic medical conditions. All of those are going to impact the health of the pregnancy. Does it make a difference? Well, one, we want mom to take folic acid. Please make sure you know why they're taking folic acid, when they're supposed to start, and how much a pregnant woman is supposed to be taking. March of Dimes says that if we have folic acid in our pregnancies, they estimate 50 to 70% of the neural tube defects could be prevented by taking folic acid. And years ago, probably 15, maybe more years by now, the March of Dimes campaigned to have folate put into some of our food sources in America. Things like breads and pastas and cereals. You'll see that they're fortified or enriched. And a lot of times that means that they've had folic acid added to it. Moms that don't have adequate weight gain during their pregnancy have low birth weight infants or small for gestational age infants. Get used to seeing these abbreviations because you will see them throughout this course and in most paperwork relating to pregnancies. So we want to know if she has a history of low birth weight or a history of small for gestational age infants, because that's going to impact how much we teach her and how closely we're going to monitor this kiddo. Does she have a history of gestational diabetes or type 1 or type 2 diabetes? Is there a history of chronic illnesses, and do any of those illnesses relate to nutrition or to the GI tract, things like Crohn's disease or irritable bowel syndrome, lactase allergies? Those kind of things make a difference when we're talking to mom about the health of her infant and the health of this pregnancy. We want to know what her usual diet is. It does us no good to tell her that she needs to eat this many fruits and vegetables, this much protein, if she doesn't know what constitutes good, healthy vegetables and good, healthy sources of protein. And some women are quite surprised to find out that a veggie pizza really isn't, 3 servings of veggies just because there's 3 different type of veggies on that pizza. Just like some of our moms think that they're getting adequate nutrition because they eat a lot of salads. Well, if the salad is just lettuce, then there's not a whole lot of nutrition in that. If they put bacon bits and croutons and all that kind of stuff on it, that again may not be healthy because those are not nutrients that they're getting from that. We want to know what her allergies and intolerances are. What's her socioeconomic status, and does she know of what some of the resources available to her are? Is she able to afford healthy food? Does she have a place to cook and store healthy food? That's all part of socioeconomic status. And then what is her knowledge of healthy nutrition? We want to know how tall she is, what her pre-pregnancy weight is, what her current weight is, Want to calculate her BMI, and there's all kinds of tools out there, and a lot of our computer charting systems, if we put mom's height and her weight in there, it automatically calculates the BMI. Does she have any signs and symptoms of malnutrition or obesity? And is her H&H at least 11 and 33? The goals are to achieve appropriate weight gain at an appropriate weight throughout the pregnancy. It's not enough that we want them to gain X number of pounds. We don't want all that weight gained in that first trimester and then they gain no weight throughout the rest of the pregnancy. So not only is it the amount of weight gain, but it's an appropriate distribution and an appropriate increase throughout the pregnancy. We want her to consume adequate nutrition through diet and supplements. And so we have to help teach her based on what she likes to eat, what she can eat, what she will eat, what she can afford to eat. How is she going to put this healthy diet together? And then cope with some of the nutrition-related discomforts of pregnancy, such as nausea and vomiting of pregnancy, like we talked about earlier, or constipation of pregnancy, and how diet might be able to help with that constipation. We want to avoid or reduce harmful practices. We want to be careful about what supplements we have mom take. Not all supplements are healthy during pregnancy. And the problem with a lot of our supplements are that our patients think that they're safe because they bought it at a health food store or because it's a natural product. But the truth is, most of those have not been tested in the population as a whole, much less specifically to pregnancy. So we don't really know what is and isn't safe. We want to teach her about the healthy eating to help support breastfeeding if that's what she's going to do once she has this baby. And the goal is to return to the pre-pregnancy weight within 6 months postpartum. It is certainly not to return to pre-pregnancy weight within that first, certainly before they're discharged from the hospital, but certainly not by their 6-week postpartum checkup. Nutritional recommendations for anyone: increase fruits and vegetables, decrease fats, increase whole grains versus refined or processed foods. We want to increase fiber, avoid alcohol. We do want them to have 2 servings of fish per week. And please look in Richie about what fishes we do want them to have versus which ones we want them to stay away from. So we do want them to have plenty of fluid intake. And we don't want that fluid to all be juices, because most juices on the market today, it comes from concentration, so it's got very little actual fruit in it, but it has a lot of water and a lot of added sugars to give it flavor. And so we don't want all their calories coming from juice that really isn't nutritionally sound. We also don't want all their calories and their fluid coming from milk, because while milk has some nutrition in it, it also, unless you're talking about like fat-free milk, has a lot of fat in it without a lot of other nutrients in it. So some milk is good, but we don't want all the fluid for the day to be in milk or juices, and we certainly want to decrease the amount of coffee, sodas, and those kind of things, because those are empty calories. Maternal weight gain. Know what is expected for a normal weight mom with a normal BMI. Know that the most important part of figuring this out is to figure out what mom's preconceptual weight is based on her height and how appropriate her BMI is to her current height and weight. So for normal women with a normal BMI, in the first trimester, the entire first trimester, that first 13 weeks, we want 3.5 to 5 pounds weight gain total for the entire trimester. And then in the second and third trimesters, we want them to gain about a pound a week. Now, this is for a normal weight woman with a normal BMI. If she's underweight, we want to put these up just a little bit. If she's severely overweight already, then we're going to decrease this. But the important thing is we don't want mom losing weight while she's pregnant. We want to increase the health of what she's eating, but we don't want her to actually be losing weight while she's pregnant. So severely underweight women, like I said, at conception should gain a little bit more weight because they're at risk to have a low birth weight infant, which can have problems all on their own. A low birth weight infant can have a smaller body size, obviously, but a smaller brain size and might have trouble catching up. But they're also at risk for things like hypoglycemia. They don't have enough fat on them, so they have a problem with thermoregulation once they're born. Inadequate weight gain during the pregnancy, they're at risk for IUGR, intrauterine growth restriction. Those babies aren't gaining weight and growing appropriately. And then our obese mom, she's at risk for CPD, cephalopelvic disproportion, which is another way of saying baby's not coming through the normal door. That baby is too big to come through mom's pelvis. Macrosomia, which is a large baby, which puts baby at risk for sugar complications, hypoglycemia once they're born, increases the risk of a C-section, postpartum hemorrhage, wound infection, increased risk of gestational diabetes, and preeclampsia, which are all going to impact the health of the overall pregnancy. So the recommended weight gain based on pre-pregnancy weight for a normal woman with a BMI between 18.5 and 24.9 is 25 to 35 pounds total for her pregnancy. If she's underweight, we want her to gain a little bit more. Overweight, not quite so much. And then obese, even a little bit less. But they should all be gaining weight because if they maintain their weight, that means that baby is not getting the nutrients because it should be increasing as that baby increases, as the placenta grows, as we produce more amniotic fluid. Her weight should go up. And if it's not, it means that she's compromising what she's got on board herself in order to baby build. And that means she's probably breaking down proteins and she's breaking down fat, and that's not healthy for the pregnancy. Here's where the distribution of the weight goes. So we have 15 pounds of fetus, placenta, and amniotic fluid. The weight of that uterus increases by 2 pounds, just the muscle mass in the uterus. There's 4 to 5 pounds of increased blood volume. Breast tissue up to about 4 pounds. Maternal stores, things like iron, calcium that's stored in that placenta and other places in mom's body, can add an additional 4 to 6 pounds on mom. And then the interstitial fluid from that increase in the fluid that mom has. Remember, we talked about mom's blood volume doubling during her pregnancy. That's about 4 pounds of extra weight because of that increase just in the fluid mom has. Most increased needs in the diet can be met with deliberate focus on the diet. Weight loss is not recommended during pregnancy, like we said. So carbohydrates provide energy. Fats are necessary to maintain the pregnancy and for development of the fetal nervous system. Proteins provide some energy, but they primarily provide amino acids for tissue growth. And that's exactly what baby building is building that tissue. So some of the concerns we have about protein, we need to have complete proteins. And who's at risk for not having complete proteins? It would be our vegetarians or women who have limited protein intake. And this could be deliberate, such as our vegetarians or vegans, or it could be that they just load up on lots of carbs with very little quality protein. Teenagers need careful counseling. One, because their bodies are still growing, so their body's got to decide whether they're going to take the nutrients for mommy building or if they're going to transfer the nutrients to the baby for baby building. But remember, teenagers are still growing, so they need the nutrients to grow themselves, finish growing their bones, those kind of things, and have enough extra nutrition to allow for growth of the baby. I want you to look up on your cell phones at some point. You can pause this lecture or do it after the lecture, but look up on your cell phone. If a mom came in, and I don't really like to eat meat, I like pizza, or I like to eat at McDonald's, how can you help her find non-meat sources of protein if she's a vegan? or she just doesn't like to eat meat. How can she meet the needs? See your notes on information about fluids and minerals. Couple important notes. We want moms to have less than 3 cups of anything that has caffeine in it. Please realize that it's not just coffee, teas, and dark sodas that have caffeine. Mountain Dew has a tremendous amount of caffeine in it. Certainly, all of our energy drinks that are out there have caffeine in it. And so we want to be cautious and make sure that mom understands that she needs to decrease and limit those. We know that more than 3 cups of coffee, or the equivalent of how much caffeine is in 3 cups of coffee, is associated with an increased risk of spontaneous miscarriage or spontaneous abortion and intrauterine growth restriction. We also know that anemia is associated with preterm birth and higher maternal mortality. Moms need to decrease the amount of vitamin A. And the one place that vitamin A, that moms may get too much vitamin A, is in acne treatments like Accutane. That's a vitamin A, and we do know that there's a health risk associated to our fetus and fetal abnormalities if mom is using things like the Accutane. Again, folic acid, we want to make sure that she understands how important that is. Hopefully, before she's gotten pregnant, we've had the opportunity to talk to her about that. So most women should be taking folic acid and probably prenatal iron, because it's very hard for most women to get the amount that they need through diet alone. Most other nutrients that mom needs can be gotten through a health-conscious attention to her diet. So let's talk about vegetarians for a minute. Vegetarians and vegan diets can be adequate for a pregnancy. They are certainly healthy, but we need to make sure mom understands how to put together a healthy vegan or vegetarian diet. We want to make sure that mom didn't just decide, okay, now that I'm pregnant, I'm going to do everything I can to be as healthy as possible, so I'm going to be a vegetarian now. And so in their mind, that just means that they're going to eat lots of vegetables and they just won't eat anything that has meat to it. Well, if that's the case, she may not understand how to have a nutritionally sound diet. She may not understand how to get the proteins, a complete protein, now that she's not eating meat. Does she know how to get all the minerals and the vitamins through a strictly vegetarian diet? Vegetarians who consume eggs and dairy are going to be much more likely to be able to put together this healthier diet and to get enough protein from those sources compared to the vegetarian that may not have any meat or dairy or eggs or anything like that. So they have to find other ways to get their protein needs. So again, I want you to look at your phone. How does this mom get protein that are not meat sources? How would a mom get folate through her diet? How can mom meet all her calcium needs if she doesn't have dairy? So look at your phones and see what you could teach her in order to get those nutrients through the diet that she chooses to use if she's not eating meats, dairies, or eggs. So vegans who consume no animal products must eat complementary proteins and take supplements of B12, calcium, vitamin D, iron, and zinc. I know that I could probably help a mom with a singleton pregnancy determine how to get her increased calorie needs in a healthy way for a normal pregnancy. But I also know that I do not have the knowledge that it would take to help a vegetarian be able to put together her diet to ensure that she had complete proteins and that she got all the minerals and nutrients that she needed. I would have to refer her to a dietitian. If our patients are vegetarian, again, we want to watch for animal product content, such as things that come in gelatin capsules, because a lot of times those are made from meat, from animal byproducts. Beef and chicken broth. Jell-O is typically from an animal byproduct. And then some of our insulins, of course, are from animal products. So what foods can they eat to increase non-animal sources of protein, calcium, and iron, and folic acid? Some of the factors that are going to increase and influence her nutrition Or does she have an eating disorder? If we're talking about a teen, we may also be talking about somebody who has bulimia or anorexia. That's going to be very challenging for her to meet her dietary needs to be able to put together a healthy diet for good baby growth if she has these eating disorders. Does she have any food allergies or lactose deficiency or lactose allergies? Things like pica, eating non-nutritive substances such as cornstarch or clay or something along those lines. Her discomforts of pregnancy, the constipation, the nausea and vomiting, those can impact her nutrition. What are some of her cultural, ethnic, and religious differences that are going to impact nutrition? Psychosocial and socioeconomic factors, education, and psychological factors. Of course, if we're talking about somebody with pre-pregnancy depression, does she need to have her medication changed, one, to have a safer pregnancy, but does she need help in getting the motivation to eat healthy, to have a healthy pregnancy? Or pregnant adolescents are considered nutritionally at risk. Even if they eat healthy, they're at risk because, like we said earlier, they're still building their own bodies. And so they don't have a lot of extra to give up for this baby building. If they're within 4 years of menarche, then they're still growing. And so their nutrition goes to take care of themselves. Lifestyle choices are going to affect nutritional intake. Again, are they living someplace where they have access to ways to store food, to cook food, to be able to eat? Do they have a steady source of food? Or are they at risk because they're homeless and they don't know where their next meal's coming from? Developing body image affects nutrition choices. Adolescents, they tend to go along with the crowd, and as much as they want to be seen as independent, they're going to do what the whole crowd is doing. And if the whole crowd is going to fast food eating, then they probably are too. And again, we've talked about that may not be nutritionally sound. For our adolescents, a lot of times they're already at risk with iron, calcium, zinc, vitamin A and D, B6, and they're most at risk for anemia. So, what approaches might be effective in helping the pregnant teenager develop more nutritionally sound eating pattern? We've got to meet her where she's at. What does she eat? What is she able to eat? Meaning, what is she able to afford? Some of our teens are well aware of resources around. Some need taught, things like WIC. Some of the county health departments have food banks for our nutritionally at-risk pregnant women. We need to help them focus on increasing their nutrition knowledge. Some of them may or may not know how to cook or prepare food. Do they have access to prenatal care and healthy foods? What are some of the nutritional interventions? And yes, we can, recommend that they take prenatal vitamins and iron and their folic acid. But if they don't have a way to get those prescriptions, it might not be that, they haven't signed up for WIC, they haven't signed up for Medicaid. Maybe they need help with transportation to get to the office to even sign up for those programs. And then do they know what some of the resources are to be able to help get them to the store to buy those nutritionally sound foods? And so that's the end of this lecture.